A 53-year-old lady diagnosed as breast malignancy. Preoperative assessment was done. You can see the images. What's your diagnosis? If you want more time, please pause the video and review again. Within few seconds, I'll give you the findings and the diagnosis. Are you ready? Let's go. There is a large, more than 8 cm sized lesion in segment 6 and 7 of right lobe of liver, heterogeneously hypoechoic on ultrasound and hypodense on unenhanced CT with progressive centripetal enhancement after IV contrast. It fills from periphery to the center on CT. Hence, there is peripheral nodular enhancement in the arterial phase and more enhancement and nodularity in the venous phase with prolonged enhancement, which is more than the hepatic parenchyma in the entire lesion in the delayed phase. Part of the posterior center of the lesion shows no significant enhancement on the delayed phase of CT scan. No calcific foci are present in that lesion. Portal vein and IVC appear unremarkable. Now the diagnosis is very classical giant cavernous hemangioma. Hemangiomas are the second most common focal mass in liver and the most common benign liver neoplasm found in almost less than 10% of individuals, more commonly in females. Majority of the lesions are less than 4 to 5 centimeters in size and are usually asymptomatic and are discovered incidentally. If hemangioma exceeds 5 centimeters, it can be called as giant hemangioma and may cause symptoms by pressure effect, hemorrhage and arteriovenous shunting that can be managed either by surgical resection or by transarterial embolization. Small hemangiomas of less than 1 centimeter appear hyperechoic on ultrasound and show immediate homogeneous enhancement during arterial and venous phases on CT, which might mimic metastasis, especially in such case of breast malignancy or other malignancies where small hemangiomas in the liver can easily mimic metastasis. But in a larger lesions like this, there will be slow washout and persistent enhancement in the delayed phase in the hemangiomatous nodules. They will be more denser than the hepatic parenchyma. This pattern will not be seen in most of the hepatic cellular carcinoma and metastasis. That's the end of the session. Thank you very much for your patient hearing. Please share this with your medical groups and with your oncological and radiological residents. Give your valuable comments, suggestions and feedback. Thank you again.